This national induction video resource is brought to you by the Scottish Government in collaboration with the Improvement Service and NHS Education for Scotland. This resource is intended to complement and extend local induction practice to your individual integration joint boards. The resources are for new members to integration joint boards and hope to assist you to develop to be able to have active roles in your local IJBs. This resource is made up of 3 short videos and an online interactive session with other IJB members. Throughout the videos, we will ask you to reflect on your own experiences within your local IJB. You may find it helpful to take some notes as you watch the videos and bring them with you to the interactive session. The videos will focus on 3 key aspects of integration. 1. The rationale behind health and social care integration. 2. What is required from the legislation. 3. Your role as a member of an integration joint board. In this first part, we will focus on the aims of integration of health and social care, the background to the legislation, and what is expected from it.
The aim of integration is to ensure that services are effectively joined up and that people receive the care they need at the right time, in the right place, and from the right person. There are increasingly higher public expectations of the health and care system, particularly as more people live longer and into very old age, often with an increasing prevalence of illness, particularly chronic conditions. But even though they are well supported by new medicines and technologies, we will still have to utterly transform the way that we plan and deliver health and social care services. This is in order to continue to fully meet the needs of people and be able to do so in a financially sustainable way. 10 years ago, the Christie Commission suggested that effective services must be designed with and for people and communities, not delivered top-down for administrative convenience. This is utterly transformational. It is the integration of health and social care that is expected to deliver this transformation. By now, many, if not all of you, will have had some experience of your local IJB and how it functions and performs. You might want to spend some time after this video in quiet self-reflection about how well or otherwise you think your IJB has performed against Christie's aspiration. The Public Bodies Joint Working Scotland Act 2014 was passed by the Scottish Parliament in February 2014 and came into force on April 1, 2016. This provided the framework for the integration of health and social care services in Scotland. The legislation sets out an expectation that health boards and councils in every area will work jointly together in order to create the environment within which the integration of health and social care can be achieved and is successful. Necessarily, this has to mean so much more than a few councillors and a few non-exec directors coming together for an IJB meeting 6 times a year. It should be abundantly clear and visible for all to see that the Health Board and Council are working continuously and jointly together to ensure that the integration of health and social care is successful in their area. The integration of health and social care has been put in place to fundamentally change the way that key community health and social care services are planned, delivered, and therefore received and experienced, with an expected greater emphasis on supporting people in their own homes and communities, thereby making less use of hospitals and care homes. Integration authorities can follow one of 2 structural models: a body corporate, known as an Integration Joint Board, or IJB, or a lead agency model featuring an Integrated Joint Monitoring Committee. There are 31 integration authorities consisting of 30 IJBs, with Stirling and Clackmannanshire combining to form one IJB, and one lead agency model in the Highland Council area. For the purposes of this session, we'll be focusing on the IJB model rather than the lead agency model. An IJB is a distinct, legally constituted public body. It is not a subcommittee of either a health board or a council. The health board and council are partner organisations to the IJB, not the parent organisations. To be clear, integration authorities are responsible for the planning and resourcing of social care, primary and community health care, and unscheduled hospital care for adults, and they have oversight responsibilities to ensure that health boards and councils are delivering what is expected of them. This map sets out the complexity of the landscape within which you operate. You're all operating in different arenas, in some cases in single coterminous health board and council areas with one IJB, and in others a single health board with multiple council areas within it and therefore multiple integration authorities. In the latter, there may be some of you who are sitting on more than one IJB. In between these extremes, there is NHS Highland, which works with the two different models of integration within its boundary, and Clackmannanshire and Stirling IJB, incorporating those two council areas within Forth Valley Health Board area. So there is significant variety. If you're a voting member of an IJB, it is because you happen to be either a councillor or a non-executive director, and as such have some degree of democratically elected accountability for things like spending the public purse and scrutinising that spend, and therefore can be involved in making decisions on how public money is used. You are not, however, there to represent either the health board or the council, nor even a political party. So how does that work in practice? To give you an example of how it should work in practice, take a multi-partnership health board area, such as NHS Tayside, which has specific duties to provide health care to all of the citizens across the health board area. However, the Angus IJB statutory duty is about strategic planning solely for the citizens of Angus, and this has to be the focus of the councillor and non-executive director voting members on that IJB. It is of course expected that the Angus strategic plan will take account of other strategic plans as it is developed, and that will include that of the health board, and there has to be a synergy between the two, both of which should also have a synergy with Angus Council's strategic plan. That is not to say that the three plans should set out exactly the same things, because there has to be difference. Each public body has different statutory duties after all. But it does mean that the non-executive directors and councillors sitting on the Angus IJB can be confident that these other plans have been taken into account in their IJB plan. That would allow them to then focus solely on the needs of the citizens of Angus when at an Angus IJB meeting. Incidentally, the Angus IJB's strategic plan should also be taking into account the strategic plans of both Dundee and Perth and Kinross IJBs as it is being developed. This highlights the absolute necessity of effective collaborative and cross-boundary working to ensure that the health and care needs of citizens in each local authority area and the health board area are properly being considered and planned for.
Before we move on to part 2 of the video, perhaps useful to reflect on your experience of working within your IJB and make some notes of your thoughts to bring to discuss further in the interactive session.